ALK positive cancer was only discovered in 2007. It's caused by the rearrangement of the ALK gene in your DNA, which typically occurs with the EML4 gene. It's a mutation that occurs in your genes during your lifetime. It's not a mutation that you were born with that you inherit from your parents, nor is it a mutation that you can pass on to your children. It's not known what causes this mutation to occur. There have been many theories proposed, from environmental air pollution to radon gas. However, there is simply not enough data or evidence to draw any valid conclusions on what causes ALK positive cancer. The only two known risk factors for ALK positive lung cancer are simply having a pulse, that is, just being alive, and having a set of lungs. There's absolutely no known correlation to smoking, with most ALK positive patients having either never smoked or been light smokers. ALK positive is known as the young person's and the non-smoker's lung cancer. It's typically found in young people under the age of 50, 2/3 of which are female. ALK positive is a rare cancer, and out of all the people diagnosed each year with lung cancer in Australia, around 13,000, only about 3 to 6% of those diagnosed will have the ALK positive mutation. This represents about 400 to 800 new cases each year. It has one of the worst prognoses of all cancers. Most people diagnosed with stage 4 lung cancer live only 9 months post-diagnosis, with only 35% of patients living longer than a year. Amazing strides have been made in scientific research into ALK positive cancer since it was discovered in 2007. By the end of 2018, the current 3 lines of treatment available had been developed, and the median survival for a patient diagnosed with ALK positive has extended out to 81 months, or around 7 years, with 25% of patients still being alive after 8 years. But there is still a long way to go. Most of the ALK positive patients, around 85%, are diagnosed at stage 4 and are likely to be treated with oral drugs that work to shrink the tumours. These drugs are called TKIs, and they work by blocking the receptor on the cancer cell. As a result, the signal telling the cancer cells to divide and grow never gets communicated. The inhibitors are taken as tablets at home and enable patients to live more normal lives and make the most of their time with family and friends. However, TKIs are not a cure for ALK positive lung cancer, but rather a treatment that allows a tumour to be kept in check. If treatment with the TKI is stopped, the cancer starts growing again. Patients almost always become resistant to the medication over time, and their cancer starts growing again. When progression occurs, the patient moves on to the other lines of treatment, or they return to the use of the more traditional chemotherapy and radiation treatments, although these have shown not to be that effective against ALK positive lung cancer. There is hope for ALK positive patients. Unfortunately, the stigma and stereotypes of lung cancer in general mean that it is very poorly funded. Most of the funding that is received goes to the other types of lung cancers that affect most lung cancer patients. ALK positive lung cancer research receives virtually no funding, as it represents such a small proportion of lung cancer patients. Most funding for ALK positive research is raised directly by ALK patients, family and friends. Last year, over $7 million US was raised globally by ALK patients, family and friends to directly fund ALK research. It's the generosity of patients, family and friends that continues to drive research for a cure for ALK positive cancer. ALK Positive Australia is a charitable organisation founded by a group of ALK positive patients and caregivers. Its aim is to connect, educate and raise funds to help ALK positive patients and their care teams in Australia. ALK Positive Australia supports research trials to evaluate new medications, drug combinations and detection techniques that can improve the life expectancy of ALK positive cancer patients across Australia. 100% of the funds raised by ALK Positive Australia go directly to supporting high-impact research into ALK positive cancer. This helps to improve treatment options, life expectancy and quality of life for ALK positive cancer patients. Research provides the hope for more life and has the potential to transform ALK positive cancer into a chronic, but maybe someday curable condition.
Hi, my name's John Grafdyke. I was diagnosed with lung cancer in April 2022. It was a difficult time of life. The prognosis for lung cancer at that point in time was abysmal. I was looking at about 9 months to live. Had many difficult conversations with my family and friends, most of all with my 10-year-old daughter. There was a period of time between when I was diagnosed to when I started treatment where I had to wait for the results of a genetic test. Going against the advice of my doctor, I went online to investigate the outcomes that I was looking, to face with this diagnosis. There was a lot of information out there. I remember coming across ALK lung cancer and thinking that was maybe one of the few options that I had for hope for the future. I still remember the day when we got the phone call from the doctor that confirmed that I actually had the ALK mutation and suddenly my family had hope again. I quickly dove into doing more research on the topic. I have a scientific background and to me understanding and knowledge was a powerful thing. And I was reading scientific papers and trying to find out more information about ALK positive lung cancer. And unfortunately, most of the information that I was able to find was based overseas. Overseas organisations based in the United States and the UK. Eventually I found a Facebook group in Australia that provided me some connection to other patients within Australia, and that made a huge difference. But I quickly realised that there was a need within Australia to have an Australian voice for ALK positive lung cancer, but more importantly, to have a way of donating money to ALK positive research. Because research is the thing that gives us hope. And in finding a cure for the disease and in finding new and improved treatments for us that will extend our lives. At the time, there was no options to donate directly to ALK positive research in Australia. So along with a group of other patients and their caregivers, we established ALK Positive Australia. This organisation focuses on raising money for ALK positive research in Australia and also provides support and information for patients who are diagnosed in Australia. So we're reaching out to other organisations to partner with us to help us spread the word about ALK positive lung cancer and support us in raising funds for research that will hopefully extend and hopefully one day find a cure for ALK positive cancer.